Hi, thanks for joining today. My name's Tani Aitken and I'm one of the kindergarten inclusion consultants working with Uniting. So today we're going to talk about emotional regulation. So what we'll be discussing today is understanding emotional regulation, the skills that are required for children to emotionally regulate, the contributing factors to emotional regulation, and some practical strategies that you can use in the kindergarten classroom. And what I'd like for you to think about today is a key takeaway, one or two new things that you might be able to use with the children you're working with. Okay, so let's have a look at understanding emotional regulation. Children first need to understand their emotions. They also need secure relationships. So your connections and your relationships with children are really important to help them feel they can regulate their emotions. For children in the kindergarten environment, what we'll be doing most of the time is co-regulating with them. The ultimate end goal is for them to be able to self-regulate, but at this age, and for various reasons that might be disabilities or reasons that the children are neurotypically developing or not neurotypically developing, they may need support with co-regulation. We need to understand the individual children. Every child is different, and what is going to be a stressor for one child may be very different from another. We also need to understand that emotional regulation can be a reaction. It can be a reaction to sensory overload or sensory information coming in. It can be a reaction to the environment. It can be a reaction to not knowing what to do or not having the skills to be able to resolve a conflict or share a toy. It may not be a behaviour, it may be a reaction, so it's important to consider that. What we want to do is we want to teach the children skills that they can use eventually to be able to self-regulate. We also need to think about the environment because there are a lot of environmental factors that can contribute to children's challenge with emotional regulation. Consistency is very important. If we put our ideas and our thoughts and our plan into something like a behaviour support plan, it allows us to be more consistent. It allows us to decide on an approach and proactive strategies we're going to use to support children with emotional regulation, and then for us to implement those strategies consistently. And if we're consistent, it helps children emotionally regulate because it shows them the security and that consistency of the adults that are working with them. Okay, so what is required to emotionally regulate? Children need to have the ability to maintain a certain arousal level for the situation they're in and change that. And factors such as sensory overload can really make this challenging for some children. They need to be able to monitor and modify their emotions. And in order to be able to do this, they need to understand their emotions. They also need some of the executive functions, which are the higher level brain functions. And some of these include impulse control, memory, problem solving, and theory of mind. Now, theory of mind is where a person knows and understands that other people have different feelings, thoughts, behaviours, and actions to themselves. And it allows you to predict what other people might think, say, and do. Now, we know that children who are on the autism spectrum or may have other conditions such as ADHD or other similar conditions can have challenges with theory of mind. And for those on the autism spectrum, this can go all the way through to their adult life. And if we do have a challenge with theory of mind, it can make it very difficult to be in social situations and understand what you are supposed to do or how other people might be feeling. We also know that with typical development of children, some children haven't developed this theory of mind until around the age of 5. So understanding that somebody else has different thoughts, feelings, and emotions to themselves can be very challenging for some children. So for emotional regulation, children need to understand social situations and what to do and how to solve problems and how to get along. Where there is a lack of any of these skills, it can lead to stress and anxiety, and that stress and anxiety can cause a challenge in their ability to regulate their emotions. Okay, so what can we do? First of all, we can look at the sensory input that's happening in the environment, and we can look at ways we can reduce that sensory input, because this can be a really simple way to help children regulate their emotions, as sensory overload can play a very big part in the ability to regulate emotions. We also might need to look at giving access to sensory input for those children who are seeking out the sensory input. And also, again, if children aren't getting enough sensory input, particularly for those children who are sensory seeking and have conditions such as, or disorders such as autism spectrum disorder, they may need this sensory input to help them feel calm and organised. And another thing that we can do very simply is scheduling preventative breaks. And I'll talk a bit more about how we can do that. Okay, so let's look first at how we could reduce the sensory input, which can act as a calming, regulating way to help children manage their emotions. So a very simple way is we can run an indoor-outdoor program. This reduces the sensory input for children and allows them to be in an environment that has the right amount of sensory information for them. If it's too noisy in one area, they can move to another. If they want to move more and run up and down more, they can move to another area. And it puts that self-regulation back to the child. We can reduce the sensory input by having a quiet area and a space. And this may not be our chosen quiet area or space. It should be guided by the child and what is quiet and calming and where they want to be to reduce their sensory input. Obviously within the boundaries of what's safe and what's appropriate in the kindergarten environment. We can offer them some tools to reduce that sensory input. They could have headphones, hats, sunglasses, blankets, reducing the visual and the auditory sensory input that they're receiving. Now let's look at the children who are seeking out sensory input or giving them access to more sensory input to help them regulate their emotions. You've got your first example of a child who runs up and down the room. This child is movement seeking. They need more movement input to help them feel calm and regulated. Why don't we think about how they can do that in a safe way? These are the children that an indoor-outdoor program works really well for, because they can run up and down outside and it's safe and it's appropriate. But when it's an indoor classroom environment and they're running up and down the room, it's not so appropriate. So if we set up the program so there's indoor-outdoor, they can run up and down outside and it's safe. The child who climbs on the tables, again, they're seeking that movement input. So having time in the outdoor environment where they can climb and they can freely climb on appropriate climbing frames and swing on the swings and engage in activities where they're getting that sensory input they need. Child who crashes into things and others, they're looking for that proprioceptive sensory input, that feedback through their muscles and their joints. So we might like to think about, well, again, indoor-outdoor and having some crash mats and some appropriate activities set up where they're getting that access to be able to crash into things or get that deep pressure through their joints in an appropriate way. But we could also engage in some sensory activities with them, some proprioceptive-based sensory activities that could help give them some feedback through their muscles and their joints. And I'll talk about some of those in a minute or so. So you've got a child who likes to play with the taps. So they're seeking out that water input or that touch input on their hand, and they're doing this to help feel calm and regulated. And if we try and stop them, this is where you may see a challenge with their emotional regulation, because they're getting something from playing with that water and playing with the water on their hand that's helping regulate and calm their sensory system. And if we stop them from doing that, or we keep redirecting them away without providing a replacement behaviour, the behaviour is not going to stop. The child is going to continue to try and seek out that sensory input and play with the taps because they need it to feel calm and regulated. So we need to think about offering a replacement behaviour, which is access to water play in an appropriate way that's available to them, that they can access, that's going to be easy for them to access, that's going to be just as easy to go into the bathroom or easier than going into the bathroom. And if the activity that we provide is not just as easy to do or easier, it won't be a suitable replacement behaviour. Okay, so let's have a look at preventative breaks. This is something that we can think about to help the build-up of emotions, and it can act as a proactive preventative strategy. And this is really where we want to be targeting our time and effort and thought, is to these preventative strategies that can help the build-up of emotions. So what is a preventative break? It's really just a break for your brain. It's a break from the activity that you're doing, and it supports the build-up of tension, anxiety, emotion, and sensory overload. We as adults have preventative breaks. We might go and have a coffee, go for a walk, grab a cup of tea, sit down and read the news on our phone. It's just a break from what we're doing, a break for our brain, helping us to reset and calm before we go back to work or the next activity that we're doing. So we know that all young children need support with their emotional regulation, and we as adults need to help them to self-regulate. So what we want to do is we want to teach them how to have preventative breaks, and we want to schedule those preventative breaks into the day so they're able to engage in those and get used to those strategies to ultimately be able to use those breaks themselves or take those breaks themselves. And we do know that some children need it more than others, and this is where your observations of the children and what a preventative break might look like for them is really important. Okay, so how are we going to set up those preventative breaks? First, we need to observe the children and we need to look for patterns in their behaviour. Are there particular times of the day that they need a break? Are they happy to be inside and play in an indoor program, but after about 20 minutes or so, it seems like they need to have a bit of a run around? Sometimes transitioning the child outside for a run around and then back in can be really challenging because it involves that transitioning to a preferred environment, but then back into the non-preferred environment. So we might want to think about setting up the breaks in the environment that they're in if you're not running an indoor-outdoor program. We want to set up these breaks based on the observations about what the child needs and when they need these breaks. We want to individualise the breaks, so they need to be according to the child's needs, and they need to be breaks that are based on the child's interests or breaks that we've observed and tried that seem to be calming and regulating for the child. What we want to do is we want to introduce a break choice card. We do want them to be able to ask for a break themselves and do that independently. This may not be appropriate for all children, but there might be some children that you can introduce a break choice card and teach them to be able to ask for breaks. And you can also use social stories to teach them about preventative breaks, why we're using them and what we can do. The end goal for children is for self-regulation, and what we want to do is we want to teach them the strategies that they need to be able to self-regulate. Okay, so what are some examples of preventative breaks that we could do with the children? We could simply just get them to do a job with us. It's a break away from the activity that they're engaging in. It could be putting things away with you. It could be helping you put out a craft activity or pack it up. It might be putting out the mats for lunchtime. It's just a break away from what they're doing, and it might be just doing something to help you. It could be quiet time or a break from the noise. That can be very calming for some children, is a reduction in the noise or a time where they can get a little bit away from what's going on in the busyness of the class and the rest of the group. Some children may need a physical movement preventative break, a large or a small body break. And I'll talk a little bit more about what those breaks could look like with the physical movement, with the large and the small body breaks. But it can be anything. It could be time on the swings, it could be an obstacle course, it could be running up and down outside, a scheduled dancing group time, those kind of things could be a preventative break for some children. It could be some time playing with something that they're really interested in, a special interest, or a toy that you've got away that you get out just for break time, that's something that's calming for them. You can look at your general calming activities such as breathing or meditations and mindfulness, yoga, those kind of things, if they are something that's calming for the children. And that free choice of environment can help children to self-regulate. So if you are running an ideal indoor-outdoor program where the child can freely choose where they are, they may be able to self-regulate at times rather than the adults having to regulate with them. Okay, so when we introduce these breaks, we want to show them and give the children the break information visually and schedule it on a timetable. So children need to be able to see, they need to be able to have a choice, and it can also act as a reminder to have a break and what to do. We need to teach them what to do and how to have these breaks and what are the activities that they can choose from or why they need them. We could write a social story about preventative breaks, about when you're feeling sad or frustrated, for example, how you might feel and how you might behave. These are some of the reasons why you are behaving like this, but these are some of the things that you can do to make yourself feel happy. And when you are writing the social story, you really want it to be individual about the child, about what are the stresses for them, and also what are the calming activities that are calming for them. When I talked before about small and large body breaks, these are just some occupational therapy based small body breaks that can help children calm and relax through proprioceptive or deep pressure input through their muscles and their joints. And these can be very calming for children who need some regulating or some deep pressure input to help them feel relaxed. And these are some larger body breaks, which are similar to the small ones, but it's using the whole body in the movement. We can use our calming routines and our breathing activities. And again, I would encourage it to be in a visual support as well. It reminds the child of what to do, but if it's up in the classroom, it can act as a reminder as well for you to support the child through the routine. And another breathing activity, a calming one, a simple one of rainbow breathing, but there are many that you can use. We're looking at teaching children to ask for a break or ask for help. This is an example of the asking for help choice card. So what we want to do is we want the children to be able to ask for a break or ask for help when they need it. This may not be appropriate for many of the children, but there might be some children who are ready to be prompted with the step-by-step of how they ask an adult for a break or for help if they're struggling in a situation and they're finding it difficult to regulate their emotions. Social skills can also be a contributing factor to emotional regulation. A lack of social skills or a challenge in knowing what to do in a social situation. And one of those areas might be problem solving. So this is an example of a visual support you can use with children to teach them what to do when there is a problem that they need to solve. So it's targeting your strategies into giving them the skills they need to be able to be in a social situation and know how to respond. Okay, so we've got a few things to remember about emotional regulation. We want to help the child get better compared to themselves. It's about making small, achievable goals that are suitable for the child to help them make improvements from where they're at right now, not compared to the other group, to the rest of the group or the other children. There are so many skills that are needed for emotional regulation. Just a few: impulse control, emotional control, self-monitoring for self-regulation, planning and prioritising. So many skills. So what we need to think about is that we can't work on it all at once. We need to start with one area or one skill, and we need to support the child with that area and focusing on one goal at a time so it's not too overwhelming for the child, but also for yourself. What we want our strategies to be aimed at is prevention of the behaviour or prevention of the emotions building up, rather than after the behaviour has occurred or after the emotions have built. Now, we do understand we don't always get there prior to the child's emotions building up, and while they're building up, we sometimes miss those subtle signs that their emotions building, or we're working with other children and we haven't seen it. So sometimes the emotions will come out with the child, and there isn't much we can do when they're at that stage where they're having a meltdown or they've lost control of their emotions. but we can be there to support them when they're calm and they're ready and make sure the environment's safe for them after they've had that release of their emotions. Theory of mind, as I mentioned before, plays a really big part in the child's ability to regulate their emotions. So asking a child, when a child's hit somebody else, asking that child, well, why did you hit them? And how do you think that other child feels? It's going to be, for some children, impossible to answer, how do you think that other child feels? Because they have no idea. They don't know that the other child has different thoughts, feelings, or from themselves, and they can't predict how they're feeling. So just remember that theory of mind can be challenging for some children that you're supporting. Okay, so a lot of areas we've discussed today in emotional regulation, and really what we've focused on today is preventing the build-up of emotion and strategies around that prevention of emotional build-up and strategies to help children regulate. So I hope that there's a couple of key takeaways that you've got from the presentation today that you can use with the children that you're working with. Thank you.